This is Dr. Miller, the brain doctor, and we're going to talk about another rare condition today, progressive supranuclear palsy. This is something that it's difficult to diagnose, and even experienced neurologists like me don't think about it sometimes. We see someone with sort of a Parkinsonian kind of look, but they don't have tremor, and we don't think about it until the second or third visit. People have gone a long time without being diagnosed with this because people don't think about it because it's just so rare. You're in a private practice, you're an internist or family practice doctor, you probably never see a case of this. But you should think about it. It's very rare, and the nerves get destroyed and parts of the brain that control eye movements, parts of the brain that control breathing and muscle coordination, and they lose the ability to move their eyes. Now, when I see a patient that's any kind of Parkinson syndrome, Parkinson plus, man, one of the first things I do when I finish the exam is make sure they can look up. They cannot look up. They have loss of vertical gaze. They can't look up, they can't look down. But with the doll's eye, you know how you take a doll and you roll their head around, their eyes will move. They move with doll's eye movement if you move their head, but they have no vertical gaze. The earliest symptoms are just frequent falls, stiff, slow, the walking becomes very awkward. They just look like a patient with Parkinson's disease. They tend to lean or fall. They have facial weakness, slurred speech, trouble swallowing. They have a sort of masked face, expressionless face that a Parkinson patient has. They can be very emotionally labile. So cry in 1 minute, laugh in 1 minute, mean 1 minute. Their memory is generally pretty good. So they don't have a tremor. And sometimes they have sort of the bug eye look, sort of wide-eyed stare. So I see someone with a sort of a Parkinsonian look with wide eyes. I check their vertical gaze, and we just don't do it. Everybody does this, but they don't pay attention to have them look up and down. It's a terrible disorder. There's no treatment for it. No treatment options. They don't respond to the medicines we use for Parkinson's disease. We call this PSP, progressive supranuclear palsy. Like, subscribe, make comments. More later.